the nation, Vermont is in the midst of a sustained increase in COVID cases, fueled almost entirely by the highly contagious Delta variant. Today, state leaders said it's not just the cases that have them worried, but, as we've seen in the past week, an uptick in hospitalizations. Local 22's Devin Bates joins us now live in the newsroom with more from today's weekly briefing. Devin?
Yeah, Lauren, in the past few weeks, we've learned that Vermont's 84.6% vaccination rate hasn't been enough to curb the spread of the Delta variant. And it's for that reason that Governor Phil Scott is now considering new measures to boost that number, some of which he previously suggested were off the table.
Look, I know Vermonters are concerned as we see the rise in cases from the Delta variant across the nation and here in Vermont. This isn't where we wanted to be.
Faced with rising cases and hospitalizations that are expected to continue through the coming weeks, Governor Phil Scott took to the podium Tuesday urging employers to incentivize and require vaccinations, with an emphasis on hospitals and long-term care facilities.
To help set the example, I'm announcing today that my team is working to do the same, starting with certain state institutions like the Veterans Home, correctional facilities, and our psychiatric hospital.
Scott had previously dismissed a mandate for state employees, but said the rapid spread of Delta has changed things. We'll learn more about those plans in the days to come, but it doesn't appear a wider mandate for state employees is on the horizon, at least for the time being.
It's not something that we're ready to impose at this point in time, but as we said from the beginning, we're watching the data, we're listening to the science, we're trying to do what's best for Vermonters.
As of Tuesday, 24 Vermonters were hospitalized with COVID-19 and 9 were in the ICU. What's more, State Health Commissioner Dr. Mark Levine said we may only be just starting to see the impact of this Delta surge on the state's hospitalization rates, which had him tripling down on some familiar advice.
Let me just start out with 3 key words: vaccination, vaccination, vaccination. It's not politics, it's not an agenda. It's public health, medical science, plain and simple.
Now, Governor Scott was asked if there should be stronger mask recommendations coming from the state level, particularly in counties that are above the CDC threshold for high transmission. Now, he said at this point, he still thinks that's a personal choice and people should be making that call based on their own risk and the risk of people they live with. Live in the newsroom tonight, Devin Bates, Local 22 News.